You know, there's always this kind of, you know, I'm in government, so to some extent, I can understand it. There's always this government mentality of, this is our responsibility. You know, we're trying to make the world a better place or something. These people are trying to make a profit. You know, maybe we can't trust them.
When we began to talk with the private sector, we realized that, in fact, many of them did have concerns about development that in some cases were serving their self-interest as profit-making companies, but for others there was a real humanitarian streak, feeling that they could do something to make the world a better place to live.
Many of these companies produce products, whether it's pharmaceuticals or medical devices or other things that are of critical use in terms of improving health in the poorest communities. They have to be a part of the picture.
Somebody from the nonprofit, non-governmental, or nonprofit NGO community made the comment that, well, yes, we want to work with the private sector, but there can't be anything in it for them. And that's a real problem. I mean, the fact is, everybody's at the table because something is in it for them.
We have manufacturers and companies that sell and market in the developing world. They have their workforces, they have their customers, and in all of those cases, unless those people are healthy, they're losing money. And so they have a very clear self-interest in doing the right thing.
It's not necessarily the bottom line, as in the case I cited with Procter & Gamble, where it was employee retention that actually helped drive their interest and motivated their participation. But rather, you know, we'll have to look for opportunities that are, you know, like that. And I think that even if it is in the interest of a for-profit corporation to make money, if they can make money and still deliver the service effectively, then we have to look for that as an opportunity as well.
Public sector in a lot of these countries does not trust the private sector, doesn't know how to work with the private sector, or doesn't want to work with the private sector.
There are parts of the difference in mindset among government, NGO, private sector that will always be there. They're supposed to be different, and there's nothing wrong with that. But a great deal of the mistrust is based on misconceptions and misunderstandings. And that's why it's so important that very active dialogues and engagement of all three sectors in common planning and common programming is so important.
Just in November, AID did a workshop in Tanzania, bringing in 6 countries from East Africa to talk about improving contraceptive supply. And every single one of those governments said they weren't certain of the value of the private sector or didn't know how to work with the private sector. And Kenya was one of those countries. Even though Kenya has 20 years of experience now working with the private sector, and 50% of Kenya's family planning use comes through the private sector.
I suppose the nonprofit sector, when they look at the problems like this, they really are viewing these as public problems and therefore not problems from which anyone should make money. The reality is that many of the problems, at least the problems that I work on, which are ones that involve household expenditures on things that actually benefit households themselves, are things that the private sector can in fact play a role on and potentially could make money on.
Going back all the way to the Reagan administration, where it was much discussed, is the basic incompatibility of having public health objectives and organizations which exist to maximize profit for their stockholders. And we really haven't quite figured out how to address that. That certainly has come to the forefront with the issues of ARVs, and I think will also come to the forefront with the HPV vaccine.
These kinds of issues that I'm talking about, whether it be hand washing with soap or infection of water at the household level, there are lots of products out there. You can go to India, and there are lots of products out there, all pitched at the 300 to 400 million Indians who are middle class or better. You go at most places in the world, and you can buy large, Rhodoplast black plastic storage jugs to sit on your roof to collect water. when it is available from a pipe system, and then it gets to, then you store it up and use it when the system's not on, which is maybe as much as 22 hours a day. And so those with means have products already pitched to them that people are making money on. The question is, has anybody without making a profit succeeded in actually serving the poor? And the answer is no. So if we can figure out ways of actually helping provide products along these lines that actually can serve the poor and protect public health, then I think we should be supportive of the private sector in doing that.
The private sector is a huge part of healthcare provision in the developing world. In fact, in a place like India, it's been estimated that as much as 80% of the healthcare that's done is done through the private sector. And interestingly, among the poorest of the poor, they have a higher rate of private sector care than even the more affluent people do. They go to local practitioners, what the Indians refer to as quacks, and local pharmacists and people who are outside the governmental or NGO sector. So we have to recognize that these people are an important part of the healthcare equation and continuum. They have to be trained and brought into sort of appropriate medical approaches, public health approaches, and they have to be made real partners in this process. Obviously, they have their own businesses to run. They have to do this from the standpoint of what will support them and their families.
The major contribution that the private sector can make is to take the burden away from the public sector. Public sectors are pretty well stretched to capacity. And when you look at the health statistics, not just of family planning, but some of the other child survival statistics, you find that there's been a plateauing of absolute percentage of users, or a decline in the percentage of users. But behind that number is large increases in the actual numbers of users that these health systems are having a hard time accommodating, both just in terms of physical capacity, the need for drugs, and then the need for human capacity to deal with this increased numbers of people visiting clinics. So the private sector would be an easy way for the public sector to relieve that burden. It also will then increase human capacity, because if you make better use of the private sector providers, then you can increase the pool of people providing services.
One of the biggest mistakes that donors have made in the last 3 decades has been not to make fundamental investments in the public health sectors of the poorest poor countries. And we're reaping the consequences of those ill-advised investments. With the huge influx of funds for HIV/AIDS, TB and malaria, the fragileness of the public health sector has been brought to the forefront.
The weakness or the decrepitude of public health systems is not an argument for the private sector providers. I think it's an argument for providing the bare minimum necessary to keep the public sector effective and active. I think, though, the reality is that people like choices. People like to be able to look at where the quality is best and the cost is most reasonable, and that cost includes their own time and the way that they're treated and so forth. Then we can let the customers make thoughtful decisions on their own.
But in the case of Bangladesh, and I would say in Colombia also, the government was fairly enlightened and sort of recognized that they can't do it all. You know, all over the world, these public sector infrastructures are really deteriorating. Some would say crumbling in many places. So I think virtually anybody objectively looking at it from more than, within 3 feet can see that you need something. If you want to accomplish public health objectives, you need more than the public sector.
When I see Bangladesh, I see only 10% services are provided by the public sector, and 65% services are coming from the private sector, and the remaining are coming from the traditional sectors like healers and the religious leaders and other types of services, those are traditional services. So government is investing a lot of money, but these statistics from the national health accounts very clearly states that this is not the case. The private sector are the major players, and government increasingly recognizing that.
You have to think of 3-4 decades of donors, and including myself, wanting to have measurable and quick results, and thus instituting vertical programs that were designed to bypass the bureaucracies and the dysfunctional aspects of systems by creating a different way of getting services rapidly and effectively to the maximum number of people, has led to physical and human capital being totally inadequate for the poorest of poor countries.
We need to work with the public sector to help them gain a better understanding of the benefits of the private sector and more abilities for them to utilize those services and sort of keep a policy role and see that their role is policy and that they can benefit from improved overall public health, but still using a private sector as one of the mechanisms or tools that they have to do that.
I'm uncomfortable with donors investing in the private sector infrastructure to develop a parallel, an alternative to the public sector. I think public health is basically a duty, a responsibility of governments. And it always has been. Governments haven't always fulfilled that, but by definition, public health is something that the public sector should take primary responsibility for.
For the kinds of things that I'm focused on, the two key things that I think that the private sector can bring to the table. One is there's a certain degree of innovation in technology, which represents typically a private sector function, or at least something the private sector is likely to invest in. I mean, we also, through some of our partnerships, also make investments in technology. But in terms of just the breadth of things that are going on out there, there's a lot of private sector interest in some of these issues that we work on, at least some of the issues that I work on. And so there's an opportunity to exploit all of that innovation and all the different things that people are already developing and investing in themselves, and to try to figure out ways of bringing that to bear on the public health problems that we're addressing.
The other challenge is that you need to have a regulatory environment, in a sense, for private sector that on the one hand promotes the kind of quality that you want to see. So for example, maybe requiring a certain amount of training for some kind of service might make sense, or a certain certification could be very helpful. But on the other hand, you don't want something that inhibits people from doing needed services needlessly. And when you're dealing with the health sector, there's a lot of privilege. There's a lot of, only doctors can do this, only nurses can do this, when in fact a lot of public health services can be done and done quite well by conscientious, quote unquote, lower level, I don't necessarily like to use that term, providers.
One of the continuing problems we have is sort of the tyranny of the formal medical profession. I think that we could greatly expand through private health providers, but not private physicians or even nurses, using them as service points. They could earn money and at the same time greatly expand access to rather basic health commodities and services.
So for example, providing pharmaceuticals would be a classic example. Some countries, only doctors can prescribe pharmaceuticals, even though everybody knows that they're marketed freely. But that gets in the way of us doing good services. So it actually fits in the general concept of delegation. I mean, there's a major human capacity problem in Africa right now, and skilled people are leaving. And one of the solutions has to be enlightened delegation of authority, of ability to do things. And otherwise, I don't see any way out of what we're doing.
Part of what led to the success was that the private sector did high quality services and wanted to make sure those services were there when people needed them. And this was overall true of all of the health services, not just the family planning. So the family planning rode on those coattails. Then when the private sector started to see this work in the communities in which they supported, they got behind it to a greater degree and started to add a lot of resources. So in many cases, new clinics were built, a lot of community outreach was done, workers released to do some of these community days to promote family planning. And one of the other things that we did was integrate it a little bit with maternal child health services, because it would, when women would come in, it was an opportunity to do immunization for children and talk to women about health in general. So it was a real synergy that the community liked it, the private sector liked it, and the more people liked it, the more they took it on and wanted to do more. And then greater acceptance in the community as a result.
In the case of Bangladesh, it's taken a fair amount of donor support and subsidy and a lot of hard slogging, I would say, over many years to build up an infrastructure in that country. And I think that there's probably been some good leadership. I mean, there is a certain amount of identifying champions and people that are sort of have passion about what they want to do, as well as, of course, make a profit. So the social marketing in Bangladesh is self-sufficient to the extent that it only requires a source of contraceptive commodities in order to be sustaining.
The private sector institutions or business institutions should recognize that private sector health is another area where they can invest. That's not recognized as yet. So the banks are not recognizing that they should invest on private sector health, human resource development, or SME development. They are investing on agriculture. They are willing to invest on agriculture or fisheries or livestock or plastic industry or any other industry, small scale, but they are not willing to invest on a small pharmacy or small pathological lab.
It's much easier for us to partner with the multinational private sector. They understand how to work internationally. They understand the nature of working in with large organizations. But frankly, as in many places, the local private sector in many of the places we work is really very vibrant. And we want to figure out ways in which we can also harness and support and facilitate the participation of the local private sector to deliver some of these goods and services that we've been talking about. And I think that if we can do that successfully, it actually has the potential to reach many more people than we can through somewhat more unilateral and unidimensional approaches that may be represented by a partnership with a single multinational corporation.
The jury is still out on the full potential of using the private health sector as a means to fulfill public health objectives is still not known. And it's very difficult to generalize about that because it very much varies from one country to another. So that the potential in say a middle income country in Latin America or Southeast Asia is much different than a country in sub-Saharan Africa. And there's a couple of issues. One of the issues is equity of the ability of the for-profit sector to provide services at a cost that is sufficient to get a return on their investment and at the same time provide services to the poorest of the poor.
A vast preponderance of resources that will be available to the developing world over the next 20 to 30 years will come from the private sector. Unless they are partners in this whole process, we're going to lose tremendous opportunities for improving health.